All right. Hey, everybody. Thanks so much for being here today. We have a super packed agenda, so I'm going to go ahead and get us started. Um, if you have not seen the agenda, you're welcome to follow along. I'm going to put it in the chat one more time so y'all will have it. And if you have not already signed into the chat with your name and email, please do that as well so we can have a record of you being here. All right, so we're going to start off with our community calendar review. So there's a couple of things for you on the agenda. The Elizabethton City Schools Back to School Bash is this Saturday. And then there's also a Holston Habitat for Humanity build coming up soon. So take a few minutes to check those two things out. And then I also wanted to open the floor to anybody else who has things coming up, events or activities, or ways that we can support your organization. So anybody have anything they want to share?
Coming up, but I'm Ashley Arnold, and I'm really sorry. I'm in a place where I can't get my camera on, but I'm with Tennessee Voices Survivor Connection program, and I'm sure some people are familiar with the program, but our program has changed a little bit since the fiscal year rolled over. We have no cap on ages anymore, so we can serve anyone of any age. We are across the entire state of Tennessee, so we can serve anyone across any county. Of course, part of it will have to be virtual, but referrals are still very simple to do. You go on the Tennessee Voices website and click on Survivor Connections under program, and services are free. So anyone of any income or lack of insurance, it doesn't matter. We can serve anyone.
Thank you for sharing. Anybody else have anything they want to share?
I do, actually. This is Andy Hall, and I am with Groups Recover Together. I can't turn my camera on either, and I apologize for that. And I just wanted to let you guys know that we are an outpatient opioid treatment program, and we have a virtual program so we can cover the entire state. However, we do have offices in Knoxville. Let's see if I can figure out. Knoxville, Oak Ridge, Morristown, Kingsport, Johnson City, Nashville. We're opening in Greenville and in Sevierville, and we've got one other one, and I can't remember where that is. But starting next week, if we have members that want to go in office, starting next week, they will be allowed to. So we are working on a back to office plan altogether. But starting next week, we will have the virtual groups for anybody who's in the state that needs to do virtually. But if there are members that want to go into the office starting next week, they can go in. So I just wanted to let you all know about that. And that's it.
I had an announcement too.
Oh, go ahead.
It's on the agenda, but the Elizabethton City Schools is having their back to school bash Saturday. It's going to be open to anyone that comes. It's from 8 to 12, hopefully at the football field. But there's going to be a ton of resources. The health department's coming and offering vaccines. There's going to be backpacks, free school supplies, inflatables, free haircuts. There's going to be some barbers there. So it's hopefully going to have a really big turnout. We have 1,000 backpacks to hand out. So please come or spread the word about that. It's 10 to 12. If it rains, we have plans to move it inside, but we hope that it doesn't rain and it can still be on the field.
And I'll go next if that's okay. So I am Caroline Rodriguez. As some of you may know that I was working with the Survivor Connection program with Tennessee Voices, but my role has changed as of this new fiscal year, and I am the outreach specialist with Tennessee Voices statewide family support network now. And what we do is that we provide free outreach services to parents and caregivers in school, juvenile courts, mental health systems, and DCS, as well as other child service agencies in every county in Tennessee, but I am in charge of Northeast Tennessee, and I cover 8 counties. And we do outreach support to caregivers and children. We help them with IEP. So any child that has any emotional disturbances, and we work to help the parents learn the process of IEPs or any type of 504s. We tell them the difference. We provide education, parent education classes, and education about the IEPs as well. So this is new in Northeast, because Northeast really didn't get covered last fiscal year, but I'm here to serve this community. So if you guys need any information, let me know. My information is on the chat, and I'll be putting some more information in there about our library, because we have an online library that gives assistance with mental health as well.
Thank you all. Anybody else have anything they want to share before we move on?
Hey, can you hear me? Okay. I am Tyler Wright, and I am taking over Jane Harper's old job as the Regional Health Council Coordinator. And I just wanted to put my name out there and say hello to everybody.
Yay, thanks, Tyler. We have all kinds of jobs for you already. Super excited to have you. Anybody else have anything before we move on? All right, so y'all get to hear from me today a little bit more than normal. I wanted to do an annual update. I like to do this at the beginning of our fiscal year each year, which is July 1st. So I wanted to share just a little bit about Carter County drug prevention, kind of some of the things that we've got going on and some of our successes and barriers from the last fiscal year. So I'm going to share my screen. So I'm also going to put a link to this in the chat. So if you all want to follow along on your own, you can do that. I also have some paper copies of this. So if this is something that you would like to have, please let me know. And I can get you some of those as well. So I'll put this in the chat for y'all. Also, if anybody has anybody in the waiting room right now, there's a couple people that have names like password that I'm not letting in. So if anybody knows who that is, please let me know and I will let them in. I'm just trying to keep us from getting spammed. So, all right. So we're going to talk a little bit about Carter County drug prevention. This first page, I'm not going to read to you, but I do want to do just a very quick recap of kind of where Carter County drug prevention came from. A lot of folks don't know the history of this coalition and how far back it goes in our community. I see Jason Abernathy in this picture from 2011, which is when our coalition really got started. Maybe not 2011, maybe it was a little after that. But and so in 2011, I don't know if you all remember Steve Berwick. He worked at the Elizabethan Star and was a journalist that just really had a heart for this community and wanted to do some things for helping kiddos to not start doing drugs. And so in 2011, he started very basic, just kind of meeting of the minds and got folks together. And then they had some great meetings for that first little bit. And then Mr. Berwick actually passed away and things kind of slowed down for a little bit. But then in 2014, Angela Hageman and the ETSU Prescription Drug Abuse and Misuse Working Group sort of brought this coalition back to life. And so I think that's what this picture is of, is some of those meetings early in 2014 when CCDP was really created and as we are a coalition today. And so in 2014 is when they developed the mission and vision of CCDP, which is to create a safe and healthy Carter County. And then the mission is to reduce substance use among Carter County youth through collaborative planning, community action, and policy advocacy. So in 2005, that's when I started as a member of Carter County Drug Prevention. And in 2016, CCDP wrote for the first grant that started funding our coalition, which is the block grant that we still have today. And it focuses on prescription drugs, alcohol, and tobacco. And so when they received that funding, we were able to hire a director. And then I was able to step into that director role in 2017. I had been a tobacco settlement health educator at the Carter County Health Department, which is where I learned everything that I know about tobacco and where my heart for tobacco came from. And so I was able to bring that into CCDP. And then for the first couple of years, we had fiscal agents. And so we're grateful to the Boys and Girls Club and to Insight Alliance for serving as our fiscal agents during that kind of interim period. And then really 2018 and 19 is when we got pretty much established, and I sort of started acting like I knew what we were doing as a coalition on our own. And so from that time on, we have been really working to be independent. In 2021, we became a 501c3 and began to transition all of our grants from fiscal agents into our own organization and started becoming a little bit more sustainable. So that's a very quick history of Carter County Drug Prevention and sort of how we got where we are today. So where we are now, it's so fun for me to look back on where we've been, because in 2017, when I took this position, it was really just me. And then we slowly were able to add staff and add programs and continue just building this coalition. And so when I look at where we are now, I just have this really sense of gratitude to a lot of people that are on this call and a lot of people in our community that have built us into what we are now. So we have a 9-member board of directors. Several of them are on here today. So Ashley Williams is our chair, Nicole's our vice chair, Kelly Kitchens at Parks and Rec, Emma Carpenter is our youth representative. This is something that I will always make sure we have in place, because we live by nothing about us without us. And so for us to be representing youth in our community and helping youth in our community, we have to have Emma's voice around the table, even at the level of board of directors, so that everything we're doing, we have that input from them. Other board members are Joy McCrae, Josh Johnson, Tammy Rourke, and Jill Stott. So we're super grateful to all of them for being on our board and really being that kind of oversight level that we need and can report to and can help us build initiatives. You all are on this meeting are considered our general coalition. And so every month when we get together with you all and share resources and talk about what's going on, that's what we feel like has the greatest impact on everything that we do. Being able to hear from you all what the needs are, what we can help with, ways that we can develop new programs to assist in our community. So you guys are really the heart of CCDP. Everything that we do is based on this group of folks and ways that we can work together. We work really hard to have representation in our coalition from lots of different sectors in our community. So businesses, nonprofits, churches, anybody, parents, youth, anybody that wants to be part of this, we want those voices around the table. And we hope that if we do nothing else well, we do bring people together and make sure that everybody's voices are heard and we're able to truly impact our community with voices across the table. So we also have our youth coalition that I'll just hit on really quickly. If you have any youth that are interested, we're getting ready to get that started back up probably in September this year. So in the same way that you all are our adult coalition and contribute to everything that we do, we have a youth coalition that does the same. And so not only do they help us guide our initiatives, figure out what we need to be focusing on, but they also create those initiatives. Because I don't know if y'all know this or not, but teenagers don't really want to hear what I have to say. They want to hear what each other has to say. And so we have an amazing group of youth led by Emma, who's here today, that just creates initiatives, does trainings, provides resources, and really is out in our community working with their peers to help in any way that they can. So just a few project highlights. This was like painful for me to narrow this down to just a few things that we did this year, because there were so many awesome things that my staff was able to do this year. But a few things just to hit on. We were able to provide over 1,000 hours of parenting classes and support to community members. That's a huge deal. We really want to change this idea in our community that you don't need any help with parenting, because I don't know about y'all, but I'm like, please, somebody come and help me with these children. I don't even know. And when you think you have it figured out, you don't, and it's hard. And so for a long time in our community, that wasn't talked about, and people only had parenting support when they got in trouble. And so we've been working really hard to move upstream and say, hey guys, parenting is hard. We know this, and let's talk about it before it gets worse. And so that's such a special number for me that we've been able to provide over 1,000 hours of parenting support. And again, this is just in the last year. Big shout out to our local law enforcement. In the past year, we've been able to collect, and I would even say we've probably collected more than this, because this box is available anytime that the police department is open. And so what we know of, we at least have collected 138 pounds of prescription medications at our drug take back events. This is a big deal, because when a lot of times we feel like we have medicines in our cabinet, we don't know what to do with it, so it just sits there. Sometimes we have curious teenagers, and sometimes we have folks in our lives that are struggling with substance use disorders. And when we have that medication just sitting in our homes, it really opens us up to a lot of things that we wouldn't want to happen. We don't ever want to be an accidental drug dealer to our kids or to their friends. And so this is such a big deal, because we were able to work with them and get all of that medication safely disposed of and out of people's homes in our community. Lock boxes is another huge thing that we do. So kind of in line with that same thing, we're going to have medications in our home, and that's fine. But we want to make sure that only the people that are supposed to have access to them have access to them. And so in this past year, we've been able to give out over 250 medication lock boxes. So many beautiful partnerships are created with lock boxes, things like recovery communities that are willing to make sure that their folks have lock boxes. Even shout out to Habitat for Humanity, who has made sure that they have lock boxes in all of their houses. Frontier Health comes to us to get lock boxes for their clients. Just really, this is where I see our community really growing and thriving as partners, because everybody is making sure that their folks that they serve have lock boxes. We also have worked with our regional overdose prevention specialists to distribute Narcan. And then this next one is also huge to me, because this is really the heart of what we do. So we have offered over 2,000 hours of student programming this year. So my heart for this community is making sure that our kids have safe activities to do, things to go to in the community, places to be where they're safe and they're educated and they're able to just be kids. And so we really were able to do that this year. This is where I say shout out to Elizabethton Library, to Elizabethton Parks and Rec, to all of these amazing organizations that partner with us to provide activities. Some people say, how is Harry Potter's birthday drug prevention? And I'll tell you how it's drug prevention. First of all, because Harry Potter's awesome. Second of all, because it gives our kiddos something to do. And when our kiddos have something to do, it's much less likely for them to be making bad choices. And it also provides a sense of community. So when our kiddos feel like they're part of a community, they're less likely to do things that would hurt that community. And so it's a huge deal for us to be able to offer these camps, these activities, all kinds of things. Our staff this year attended over 150 hours of training in substance use prevention and treatment, and we were able to provide back to the community over 270 hours of that training as well. So this is things like when we go and we're educated in different substances or in the best ways to handle things, we want to get that education, and then we want to bring it back to you all, whether it's a business or a faith community or another nonprofit. We want to gain that knowledge and then share it with you all. And then another fun thing this year, the space that I'm in right now is our second office location. So that was very exciting for us. We were able to open this training center in downtown Elizabeth. And so not only are we able to offer these trainings that I mentioned, but also it increased our capacity to be able to do more activities for youth. So we love being back in downtown and being able to do fun activities that are going on down there and make sure kiddos have safe things and fun things to do. few project highlights there. I'm not going to read all of these to you, but I am really big on bragging on my team because I would be nothing without these people. And so each of these humans that takes their passion for this community and goes out and does things that they care about to make this world a better place is really why we are successful. And so I just can't say enough about my humans and the work that they do. Here's everybody. And so yeah, so we have a really unique opportunity, I think, with the staff that we have and the skill sets that they've built. And so just to introduce you quickly to them, Britt Jones is our family and community support specialist. Denise is our data collection coordinator. She's our behind the scenes collecting all of this data for me so that I can say, hey, we provided 1,000 hours of parenting support. Brittany is our drug-free communities coordinator. We just welcomed her on board not too long ago and are super excited for what she's going to do with us. Nash Acuna is our opioid response coordinator. You may know Nash also as the president of Elizabethan Arts and Cultural Alliance. And so she brings this really beautiful skill set to the table where she's able to engage with kiddos. You know, I'm really good at engaging with football kiddos and baseball kiddos. Nash is really good at engaging with artsy kiddos. And that's what's really, really cool about this team is we do all have our own strengths and specialties. And Nash provides so many opportunities for kiddos and adults in our community with arts and just different things there. Rebecca Moore is our finance manager. She's literally the only reason I survive state audits and all of the things because she keeps us all in line. She does our paperwork and all of those things and just is so valuable to our team and making sure we don't spend all of our money. Not that Jillian would ever do that, but just making sure that we're always prepared for whatever may come and that our books are in order and all of those things. Shannon, who's also on here today, is our Peak Mentorship Program Coordinator. So this is the guy who runs our one-on-one mentoring program. So if you think about kind of the Big Brothers Big Sisters model where we match an adult with a kiddo for an entire year just to build safe, stable, nurturing relationships and make sure that they have those people in their lives to negate adverse childhood experiences. That's what Shannon does. He works every day to match as many kiddos as he can with an adult that's going to care about them and going to check on them. Sidebar, if you're interested in helping with this program, we absolutely could help you, or we absolutely need help. We have a waiting list right now of kiddos and could really, really use some mentors. So if you know anybody or if you're interested, please let us know. And then I'll wrap it up with Tia, who's our marijuana prevention coordinator. She does a beautiful job of all things recovery community, connecting us with folks in the community that need resources. When I talked about lock boxes, that's kind of Tia's baby. Like she's getting lock boxes to the whole world. And also really working to develop marijuana prevention programs. This is something we've never had before, very new to us. And so looking at, hey, we know that marijuana could be legalized at some point. What are we going to do to keep our kids safe? We know that we have CBD stores all over the place now. What are we doing to make sure our kids don't access these things? So she does a beautiful job with those initiatives. Not going to read this to you, but I asked each of them kind of for an accomplishment of the past year, something that they were proud of. And so you are welcome to look at those if you would like. And then I want to go back just for a second to community collaboration. So I know I mentioned this earlier, but we could not do this without all of you all around the table. So every day I'm calling one of you and saying, hey, I have a kid that needs something, or hey, I need a park, or hey, I need a space, or hey, can you, I don't know, y'all know, I call you and ask you all kinds of crazy things. And so we could not do this work without all of our partners. And so in the past year, I just want to say we've done 127 events and activities with you all. You guys are the reason that we're able to do these things. I was thinking about an event that Shannon did last week and with Moms Demand Action. And so Miss Norma, who's on this call with us today, was able to give us gun locks, and we developed this campaign and said, hey, we want you to lock up your meds and we also want you to lock up your guns. And so just things like that, where we feel like we're really making an impact on homes in our community by being able to do things like that. we just started our Whiskey Ain't Working Anymore podcast. I'm kind of obsessed with it. If you guys have been around me, I've probably been talking about it. So Recovery Resources is one of my most favorite partners in the world. And so Craig and I started a podcast not too long ago, and I know I've reached out to several of you all and begged you to come on and talk to us. This podcast is an opportunity for us to talk to you all as our partners and say, we think you're awesome. Tell us more about what you're doing in the community. We're also going to ask you what your favorite Travis Tritt song is. So there's that. But just really engaging folks and asking you to share your story. And this does a couple different things for us. It is amazing for us to get to celebrate you, first of all, and just take a minute and say like, hey, thanks for being awesome. But it's also stigma reduction in a lot of ways. So when we have you on the podcast and we talk to you and you tell your story a little bit, it reminds folks in the community that whatever they're going through, people have been there. I always think about Ryan Witten and when he was on and he said, failure's not fatal. And just things like that, like these tiny tokens of wisdom from you all, from our partners on this podcast. So make sure you like the Facebook page and listen to all the podcast episodes. A new one comes out every Friday. Polly Jessen's on this Friday. So super excited for y'all to hear from her. But again, we couldn't do that without our partners. So this meeting, our Carter County Collaborative meeting, is a huge part also of who we are and what we do. The past little bit, we've had an average of 42 people show up. That's a huge deal, y'all. Y'all keep showing up to this hot mess of a meeting that we have every month. And you keep sharing your resources and you keep talking to each other. And that is such a big deal. That's how we can do this work. We also have our newsletter. Again, shout out to Denise for that one. That's her baby. And every month there are 350 people that get that newsletter, look at the data, find resources. And then I also can't say enough about Jane, who in the past year has created that kind of super cool newsletter that goes out every Friday to you all with just resources and whatever you have going on. It's a really great way for us to kind of spread the word about everything that's going on in our community and making sure that everybody knows what's up. And then lastly, I'll just say shout out to Elizabethton City Schools. They have been just amazing at letting us come in and work on vaping initiatives. So I actually did an interview today on WCYB with about this initiative. So y'all watch the news tonight and see if we're on there. And this is a huge deal because they've committed to saying, we know vaping is a problem and we want you to come in and help us with it. And so we're going in there every week of the school year, doing different levels of interventions and not just saying, hey, you're vaping, now you're in trouble, but saying, hey, you're vaping. Let's talk about that. Let's talk about some coping skills. Let's talk about addiction. Let's talk about really what's going on in your life. And then being able to refer kiddos to resources as well. So huge shout out to Elizabethton City Schools for that and just seeing the worth in the work that we do and asking us to come in and help their kiddos. So I wanted to share quickly our finances. Again, not my jam. So y'all bear with me on this one. You can see our total operating budget last year. The reason that I want to share this is because people look at this and are like, wow, that's a lot of money. Good job, you guys. But all of these grants, except for one, are reimbursement grants. So when you see our fundraisers out in the community, I need you guys to help us with that. I need you to say, hey, Carter County Drug Prevention has this operating budget, but they have to have the money in the bank first to be able to spend it, and then they get reimbursed for these things. And so when you see me saying, hey, we need you, we need donations, this is why. This is what our grants look like. But again, so I have this coalitions grant that at the end of the year, we will have been given $67,000, but we have to have spent that $67,000 first. All of our grants are reimbursement. So when I'm asking for money, I want y'all to always know that's why. But I have to have the money in the bank so that we can pay payroll, so that we can do all of these awesome things. And then the state or the federal government will pay us back. So please donate. Please send us all of your rich friends. We would appreciate it very much. So just a few things about where we're headed, kind of our goals for the next year. We have strategic goals for each substance that we work on, and then we also create goals for community change. So you can kind of see the goals here for marijuana, for prescription drug and stimulants, for tobacco, and for alcohol. And so everything that we do, again, every time you see me in the community with a silly event, or you see somebody with begging people to take lock boxes or whatever, know that everything we do is tied back to this action plan, which is tied back to these goals. And so we're not out there just all willy-nilly like, hey, let's do something and hope it makes a difference. Everything we do is tied back to these goals, and this is what we're striving towards. And so I want to mention the community change goals more than anything else. A couple years ago, the number of mentally unhealthy days in Carter County was 8.2. So we have 8 days a month that our folks are saying, I am not well mentally. And that's heartbreaking to me, because I think we can do better than that. And so that's something that we're really working on. And when I talk about reduction of stigma, that's why, because we can't get help for things when we're afraid to say what's going on, or when we are afraid to step out and say, I'm struggling. So you'll see a lot of things that we do this year, things like story sharing, things like having folks on the podcast, are just to get folks comfortable with saying that I'm struggling. We're all struggling in some way, I promise. And so we've got to shift that. We've got to change it to where folks are not having 8 days a month where they feel super unwell, and aren't accessing any help for that. Parenting programs, we're always growing those. And then just increasing our community engagement. Send people to this meeting, help us get more folks around the table. The more of us there are spreading the word, working together, the more successful we're going to be. So there's just a few of our goals for this year. Right. And then I'm going to wrap up with this again. Like I said, we can always use donations. We have an amazing opportunity with our funding to have some really great things in place, but we need that general fund so that we're able to do the things and then get paid back. And then volunteer. We are always in need of volunteers. We have events and activities and classes and all the things that are always happening. And so if you ever are interested in being part of that, or if there's something that you want to do, if you are like, I want to offer a class, please call us. You can use our space. We can help you spread the word. We really want to be, as helpful to you all as you all are to us. Okay. Questions about that? Anything else y'all want to know? All right. Thanks for letting me update you all on our progress for the last year. And I'm gonna ask Jeremiah if he wants to chat a little bit next. Thanks. Sorry, I'm reading the comments. Thanks, you guys. So I've asked Jeremiah to join us today and share just a few minutes about what he's got going on. So I know that we all love and value Jason Abernathy very, very much. And I want to kind of invite Jeremiah to come and introduce himself and make sure that you all know who he is and what he's got going on as he steps into Jason's role. So Jeremiah, I'll turn it over to you.
Hello, everybody. Can you all hear me? And see me and all the things? All right, I'm Jeremiah Lovelady, and I'm going to be doing my best to replace the great Jason Abernathy. I'll be the Region 1 Lifeline Peer Recovery Coordinator. And so basically that, I'm there for peer support. We're a free service to the community. So I'm there for peer support for anyone that needs it. We try to get people hooked up to whatever it is they need, treatment, mental health, you name it. I'm a big advocate for stigma reduction. So I love doing presentations and speaking on that. I'm also a CPRS, so I'm a person with lived experience with substance use and mental health issues. So anytime you need someone to speak on that or facilitate a meeting, a class, those kind of things, I'm available. And I'm just here to be of service to the community, and to be useful however I can be useful. I'm excited to be on board. I'm excited to be here and be helpful, and I hope I can help. That's pretty much it.
Thanks, friend. Questions for Jeremiah? All right. I'm gonna ask him to put his info in the chat so everybody has it and can reach out to him anytime you have a need. And we're super excited to welcome him to our hot mess of a table. Appreciate you being here. All right.
That's expressed. I'm at home.
That's us. That's how we roll. All right. So now I'm going to turn it over to Kayla Sharp, who with the Tennessee Suicide Prevention Network. As a reminder, this is something that we've been doing for the past several months at the CCC. So committees A and B have worked together to provide different kinds of stigma training to us. So we have had stigma training around substance use. We've had stigma training around mental health, and now we're going to do stigma training around suicide reduction. So big shout out to those two committees for kind of putting this together for us. And I'm excited for Kayla to share some stuff that I think will be really impactful, and just ways that we can help reduce stigma in our community. So thanks, Kayla.
Hello, everyone. Good morning. Jillian, can you make it so I'm able to share my screen?
Try it now.
Okay. While she's doing that, I am the Northeast Regional Director for the Tennessee Suicide Prevention Network. And so I am going to be here. This is going to be really informal today. Let me see if I can get this going. Can you all see this? Hold on one second. Y'all, I'm not the best with Zoom. I'm going to tell you right now. There we go. Perfect. Okay. So this is going to be really informal. You would think that I would be better at Zoom by now, but I'll never be a virtual kind of gal, much more in person, because we are a network. We're a statewide network of volunteers and professionals. We're housed under TADIS. And I also have some dogs and teenagers in the house today. So if you hear some noise, sorry, in the background. So we're a grassroots organization. We're made up of counselors, mental health professionals, clergy, law enforcement personnel, first responders, organizations such as health councils, things like that. So we are a network. We're not a nonprofit per se. We are just here as a resource hub. So I want to kind of give you an oversight about the Northeast. This is from the 2020 fiscal year. These were the face-to-face mobile, face-to-face walk-in assessments for the region. So as you can see, Carter was definitely the highest in the region, at least in 2020. 2021 will be looking a little bit different. So these are the things that we have to keep in mind. Okay. We know some risk factors in the rural communities of geographic isolation, uninsured, high uninsured rates, recruitment and retention of mental health providers. All of these things are huge risk factors in our communities. So when we talk about stigma reduction, when we think about what our attitudes and beliefs are, I'm not going to read each one of these. I'll kind of let you all do that. But when we think about what our perceived attitudes and opinions are, Casey Caudell already talked about stigma, what stigma is. But these are some of the things that a lot of people in our region believe about suicide. Maybe you've thought about some of these yourself. Maybe you're kind of reading over these for the first time and you're like, I've not thought about it that way, but maybe I do see suicide in that way. And these are all harmful beliefs. And so when we're addressing our own suicide, when we're addressing our own thoughts on suicide, I'm sorry, this dog is so distracting. So sorry, our mowers are here, so we can't put them outside. So when you think about your own beliefs and your own attitudes, and maybe you're thinking, I've never talked to anyone with suicidal ideation before. I wouldn't know how to address that. I wouldn't know how to begin that conversation. That's what we exist here at for STSPN. We want to have those conversations with you. If you've never met with somebody that's suicidal, you don't even know how to begin that conversation, but you're passionate about educating your community, have a coffee with me. I am a chronic struggler of suicidal ideation. I've struggled my whole life. I have a high ACEs score. And stories like Jillian said, we've all been there. We've all had we've all experienced thoughts of depression and had things happen to us. So sit down with me and have a conversation. We can talk about some ways that you can help, some ways that you can get comfortable talking about it. When you think about what your attitudes and opinions are, it's important to remain neutral when somebody comes to you in crisis. Be non-judgmental. Respect your differences. Maybe they're not religious. Maybe it's a coworker coming to you from a different faith background. These are the things that we have to keep in mind. So maintaining neutrality, but understanding some of the things that start with these attitudes and beliefs. So we're going to talk about some language. We also need to understand the difference between suicidal ideation and suicidal thinking. Suicide's a spectrum. Not everyone that struggles with suicidal thoughts will attempt suicide in their lifetime. Maybe they're a postpartum mom. Things are out of whack. They just had a baby. They're a new parent. Just because they're struggling with suicidal ideation doesn't mean that they've been a depressed person their whole life. And so we have to understand that the spectrum is so broad. So we can't form these attitudes and opinions on something when we don't know, we haven't walked a mile in someone else's shoes. We don't understand what they've gone through. When we think about suicide prevention, actually, before I go to the next slide, what do y'all think of? What are the first, and I want to have this conversationally, maybe people I can't see the chat, so chime in. When you think about suicide prevention, what are the first couple of things that come to mind? Anybody? What are some things that you all think of? Quiet bunch today. Okay, so maybe people think about text lines, crisis lines. Maybe they think about, a QPR training or crisis training, but then they also think about, I don't know what kind of resources, but I'm gonna send them, the crisis line for Frontier. I'm gonna send them screenings for depression on the Mental Health America's website. You're thinking about all these things after someone's already told you, right? But I love this graphic from the Depression Project. They put it out in 2020. When we're talking about addressing stigma within ourselves, within our communities, within our homes, within our friend groups, we need to start at early prevention. We need to start at the bottom of the pyramid. That's providing early education on mental health. That's learning how to be a safe parent. That's learning how to have conversations with your kids about mental health. Maybe you've never talked to your kid about suicide. Maybe your kid is 8 years old and doesn't even have any concept of suicide, but they're going to be going into middle school and they're going to be learning about these things. And establishing early on in early intervention that you're a safe parent, that you're a safe adult to talk to. This is early prevention, right? Strengthening ties between individuals and their community, valuing and prioritizing mental health over productivity. A lot of people in our rural communities that I've dealt with, I'll give you an example. I was talking to a school nurse in a very rural county in our region, and she's, sharing some lived experience with her, talking about depression in the schools. And she said, well, I don't think depression's biological. If you had just prayed more as a teenager, Kayla, you probably wouldn't have been so depressed. And she didn't have any concept of, depression there's so many things that can lead up to depression, right? Biological factors, ACEs scores, things like that. So that's why it's important when you're having those conversations to remain neutral and to not just give someone your upfront opinion on suicide. Especially if you've not sat down and really evaluated what that is. Not shaming each other online, not stigmatizing those with mental health issues. And I'm not just talking about depression and anxiety. I'm talking about the mental health issues that people make scary movies out of, split personality disorders, things like that, like calling people crazy and psycho and saying she's manic and all, using this kind of language just in our everyday conversations. That contributes to our culture and how our culture views mental health. Checking in with those that have struggled with suicidal ideation in the past. Maybe you haven't seen them in a couple months, checking out to them. All of this is early prevention. Like the crisis lines, 988, all of that that's late prevention. And those things are really important. Trainings are really important. Let's say you have another office in another county, one of their employees dies by suicide. So you want to host a training for your staff. That's awesome. We would love for you to do that. We want you to do that. But we also want you to be establishing a culture in your workplaces and in your homes. We're establishing a culture of safety and mental well-being. So I'm not going to say too much on that because hope can be hard work, right? And as suicidal people, when you're coming to someone who is struggling with suicide, sometimes we kind of get in a fix-it mode and we want to give them solutions and we want to try to find a plan X, Y, B, and C. And sometimes people just need you to understand that, when we've experienced a lot of trauma, it's not a matter of wanting to hurt myself, right? It's just a matter of wanting to not hurt, to not have to re-experience all the trauma that you've gone through, to not have to re-experience all the pain that you've gone through. You've held so much for so long. And so, that's something that people might not ever understand about a suicidal person if they've never sat down with one, never talked to one. So being willing to have these conversations, being willing to practice. I went back. Your language matters. I'm not going to read everything on this slide, but when suicide prevention workers, we are trying to change the language, the stigmatizing language around suicide. Most people say commit suicide. I get emails all the time. I heard someone committed suicide, X, Y, B, and C. And when we think of the word commit, we think of a crime. We think of sin. We think of, something terrible, especially when two words that are very highly stigmatized, commit and suicide, are put together. That's just always a negative concept, right? So changing it is important, not just for the suicidal person, but for their families, for people that are coping, for people that are grieving suicide loss. So saying died by suicide, or ended his or her own life, or took their own life. A really easy swap is died by suicide. And this isn't something to stress out about. I do it sometimes too. We grew up in a culture saying commit suicide. That was the term. That was the term that people used, and that was what was canon for so long. And so we're going to make mistakes, and so give yourself some grace, but a really easy correction and say, oh, I should have said died by suicide. And then just move on. When people notice those little changes that every day, people will pick up on it. People picked up on it when I started working in this field, and they'll notice, not saying not successful attempts, successful attempts, things like that, or suicide epidemic, things like that. We don't want to glamorize or present suicide as a dire outcome, especially in media. So just kind of making sure that we avoid any sort of sensationalism for accuracy and all of that kind of stuff. So not going to spend too much on that. Some do's and don'ts that can be stigmatizing, how to respond in conversation. Like I said, this training is very, very basic. We're not going to talk about risk factors, warning signs, all of that stuff, but we're going to talk about kind of how to respond. And so things that you can say, thank you for opening up to me. Maybe you've never had a conversation before and someone's, you can say, I don't have all thank you so much for opening up to me. I don't have all the answers. I've never had a friend that has struggled with this before, but I'm not going to leave you. We're going to find resources for you, and I'm going to help you make a plan. And I'm going to do my best, and sometimes with suicidal people, they're so depressed, they can't do the work themselves. You're going to have to do the work. You might have to look up who's accepting what therapists are accepting new patients. You might have to look up, who's taking clients, who takes this insurance. Because when you're a suicidal person, especially high risk, and when you're really depressed, calling people and getting rejected and having to do that phone call kind of thing over and over again, it can be really, really disheartening and really, really discouraging. So something that you can do as a friend, as a community member, is to help a depressed person do that extra legwork. Ways that you wouldn't want to respond are, everyone feels that way sometimes, or you brought this upon yourself, or I'll give you an example. I was a teenager, and one of the first people I ever talked to about being suicidal was one of our youth group leaders. He was a police officer. I thought he would have resources for me. And so he was the first person I ever told that I had been struggling since I was 9 years old. And his response to me was, well, suicide is a permanent solution to a temporary problem. And without knowing what my background was, without kind of knowing what my childhood was like, it really just invalidated my whole experience with depression. And I didn't open up to another person, another adult about it 3 years later until it was almost too late. And that kind of, because that person was supposed to be a safe person in the community, they were supposed to be safe, and then they invalidated my whole experience, and it really, really closed me off from wanting to open up again. So being really neutral in your response and being really mindful of how you console someone when they're coming to you about this. If you're and especially in terms of religion as well, sometimes people that are going through a suicidal crisis also might be going through a faith-based crisis, just a change in their faith, or, they might be going through stuff like that. So it's really, really important that if you are going to provide some religious advice, that you kind of really know the person really, really well, and make sure you don't invalidate their experience based on that. That's something that TSPN works with a lot of churches. And if you're a member of a church yourself, we have started a faith-based task force, and we want to get more into the faith-based community, doing these mental health trainings in churches, and equipping congregations with knowing how to respond in a loving and trauma-informed way. So if you're interested in that, let me know. Some other ways you can address stigma: talk openly about your own mental health. And don't ever feel like you need to disclose your exact trauma with suicide. I didn't have to disclose that I've been suicidal. I don't have to disclose that anything like that, but just being comfortable and talking about it, even in small ways, even if it's just sharing with a friend about how your experience in therapy has really helped you or really benefited you, sharing with a friend about how working out has really improved your mental health, since you went through your divorce. Finding little ways without oversharing really intimate details is really fairly easy to do, and really wanting to, what's the word I'm looking for? Educate yourself on misconceptions, and by sharing facts and experiences is basically the best thing that we can do. And being conscious of our language. Encourage equality between physical and mental illnesses. When I got into a car accident in high school, so many people showed up with flowers and cards, and I felt so loved and so cared for. And then when I had my mental health crisis a few years later, my parents were so ashamed to tell anyone that they didn't share with my friends what was going on. And so in their mind, they weren't equated, right? The car wreck was really important to share with folks that I was struggling with my physical health, but my mental health crisis was there was shame surrounding that, right? And so encouraging people and letting them know that physical and mental illness should be treated no different. When someone goes through a mental health crisis, you want people to show up with cards and saying how much you're loved and saying, I'm glad you're here and I'm glad that you're alive. And so encourage equality in those things. Show compassion to those suffering with mental illness. But my favorite one is choose empowerment over shame. One of my favorite Brene Brown quotes is shame dies when stories are told in safe places. And so like I said, if you've never talked to anyone before, or you don't know how to start that conversation, or maybe you have a child in your home and you're not sure how to address it, or a coworker perhaps, or you just need some practice, that's what the network is here for. That's what TSPN does. We start those conversations. And so if you want to have a one-on-one conversation with me, and maybe you're thinking, well, I do have some of these perceived stigmas and I don't really know how to address that, but I want to, let's get a coffee. Let's go have lunch. Let's talk it out. Because if you don't want to talk about it with me, I'll find someone that, if you would prefer to talk to a vet, if you would prefer to talk to someone who does alcohol and drug counseling or is a behavioral health clinician, I can find you those people. That's why the network exists. And it's really, really amazing. So, some trainings that we offer. Another way that you can get involved is schedule a training within your nonprofit, within your churches, within your youth coalitions, within your groups. All these trainings, most of these trainings can be fit to the population. So QPR, Youth Mental Health First Aid, we've got a lot more of those on our website. Other things that you can do, attend a regional meeting. If you want to do specific suicide prevention stuff and you want to know what we're doing in the Northeast 8 counties, we meet on the fourth Thursday every month at Washington County Health Department from 9 a.m. to 10 a.m. It is not hybrid because I want to see your faces and I want to get to know you all, and I want to have that community. So if you want to become trained in suicide prevention or become a trainer yourself, if you want to help with a gun safety project or tabling an event or a social media campaign, something that I would really love to work on in the next year is mental health stories in Appalachia. So I'm coordinating with someone to kind of share their experiences with suicidal ideation and mental health, and have different people kind of share their experiences. So if you're interested in sharing your experience for the Appalachia project, please let me know that too, because that would be awesome to be able to hear your story. And we also have task forces, veterans, farmers, first responders, faith-based. If you want to start your own, for a very specific population, maybe the Hispanic population, come talk to me. And then work on addressing your own personal mental health stigmas. It's really sign up for the Essence alerts through the state system. This will give you a text alert based on whatever county that you want to get notified for. And this will kind of let you know if there's any youth ER visits for suicide attempt or related behavior. It kind of lets you know real time what's going on in each of your counties. Some things that we've got coming up, because I didn't say them in announcements earlier. Sorry, I'm trying to do this really fast. I know we only have a short amount of time. We have for our very first responder conference for first responders and their families, the people that want to support first responders. They are a very, very high population for suicide. So this is the first one that we are going to be able to do, and we're really excited. It's in Nashville at the Drury Inn. It's going to be really great. We're going to have a lot of great guest speakers on how to address first responder suicide in that community. So if you all want any more information about that, or if you want to be a sponsor for that statewide event, please let us know. We're still looking for a lot of sponsors. But you're like, oh, this is a really cool idea, I would love to do something in the Northeast. Let's talk about planning something like that. Let's talk about planning a conference. If you're passionate about mental health in the Black community, let's get together. Let's start a planning committee. Let's get the ball rolling. The reason why all those things aren't going on is because there's only one employee of TSPN in the region. And so I can only do so much. So I need hands and feet. I need volunteers. We are also having our Suicide Prevention Awareness Month statewide event in Nashville on September 8th, 7th and 8th. The theme is building a mentally healthy future. So we're going to have the mental health magician and some keynote speakers. John Palmieri, the acting director of 988 and crisis coordination, will be there. The senior Brian, I can't say his name, Amandani, the senior scientist for the Henry Ford Health System that started the Zero Suicide Initiative, will be one of our guest speakers. We'll also provide some trainings with some CEUs for people that want to come. And this is for suicide loss survivors. If you know of anyone, this is not a TSPN event. This is the American Association of Suicidology. This is going to be a virtual conference, and it's going to be really, really awesome. But the theme is Healing Through Action, a tapestry of lost survivors' voices. So this is to highlight them and their experience, or to find some community. And then here's some regional resource guides. I will also send this out to Jillian so she can put it for you all. You should be able to click on the links, but maybe not. And then there's my information. Any questions? I'm so sorry about the dog in the beginning. It was really annoying. But I try to talk really fast so we can have some committee time. Anybody? Okay. Well, thanks for listening.
I actually do have a question. You said that you have organizations that are faith-based, correct?
We have a faith-based task force. So we do trainings. So we want to partner with people in the faith-based community, not just Christians and churches, but any faith-based community that would like a mental health. Any of the trainings that we offer them all completely for free. So we love to, like Jason Abernathy and I are doing a youth PPR coming up at Calvary for the Calvary youth. So things like that, we can partner with churches on if the church wants to host some sort of mental health event. Maybe they want to host an awareness walk. Maybe they want to host a memorial walk. Maybe they want to host something. That's where we would partner with churches on, or if they want to do outreach like survivor boxes, gift boxes, things like that. Does that answer
Okay.
your question?
Yes, it does.
Anybody else? All right. Well, thank you all. Jillian, I'll hand it back over to you.
Thank you, Kayla. All right. Before we move into breakout rooms, does anybody else who maybe joined us late or didn't think of their event or activity before the presentations have anything they want to share?
Hey, I'm Maggie. Me and Brooke were like really struggling to get the Zoom link over to me. So I joined a bit late. But I am now the hybrid lifeline coordinator for Region 1 North. So my specific counties of focus will be in Johnson and Carter County. My duties are are similar to what Jeremiah Lovelady and previously Jason Abernathy's were, connecting individuals to treatment and recovery resources, bringing recovery resources into the community, doing education and trying to reduce stigma, things like that. And to follow up with what Kayla said, I'm going to do the QPR Train the Trainer on, I think it's September 2nd. So then I will be available to do QPR trainings for people as well. So me and Kayla could partner on that event. So if it was ever wanted or desired anywhere, I could do that. I do have, the access to work out of anywhere in the first region, but my focuses are on Johnson and Carter. Just because they are more DHS involved. I work with the lower poverty and people who are eligible for or are currently receiving SNAP or TANF benefits, and people who don't have insurance. Not to say that I can't work with anybody, because I can work with anybody. So anytime you have, someone in this corner of Tennessee that needs help with getting into treatment, or if you want to bring in a meeting or any kind of recovery resources, or have a meeting that I could be of assistance at speaking for the substance use or mental health side, I would be glad to do that.
Thanks, Maggie. Will you put your info in the chat so everybody has it?
I will.
Thank you. All right, anybody else have anything before we move into breakout rooms? All right, so I'll open the breakout rooms just as a quick reminder. Committee A is Brooks Committee. That's the Substance Use Committee, working specifically on initiatives around substance use, trauma, mental health. Committee B is the Action and Awareness Committee. That's Shannon and Scott Stodola's committee, working on strategic initiatives for doing things in the community and meeting needs and making sure resources are out there. And then Committee C is Emily Brooks Committee, and they are our data collection, community needs assessment kind of awesome committee that keeps us together with all of that stuff. So I'm going to open the breakout rooms. Again, you're welcome to join any of them that you would like that are interesting to you. And we will do that until about 1:25, and then we'll come back together. In the last 5 minutes, we'll hear from each committee, things that they're working on or needs that they may have from the full group. So I'm going to open those now. Thanks. Welcome back, everybody. Hope y'all had some good time in your committee groups. I'm going to ask each committee for a quick update. I will actually go first because I sent Shannon on a mission to pick up a kiddo today, and so I was pretending to be Shannon for Committee B. So I'll update on it really quick. We talked about the gun lock initiative that we've got going on. I shared with folks that this is a really cool initiative that grew out of Committee B, where we're encouraging families to lock up their medications, lock up their guns, and then in the next several months, we'll also be adding some CBD bags so that folks who are choosing to use CBD can lock that away from their kiddos as well. Again, not encouraging folks to not have medications, to not have guns and not have CBD, but just making sure that all of those things are safe and away from our kiddos. So Committee B is doing awesome stuff with that. And then we also discussed several options for speakers over the next few months of our collaborative meeting. Really, if anybody has thoughts or ideas or wants to speak, please reach out to me. And we're kind of building that list of all of our speakers and education opportunities for the next several months. So appreciate Committee B hanging in there with me and me pretending like I know what I'm doing. And I'm going to ask Brooke to give an update from Committee A.
So in Committee A, we talked about, we just threw around some ideas for a, kind of a grassroots movement for a certified peer recovery specialist title for, or program for youth who have that lived experience with mental health, substance use, juvenile justice, that kind of thing. And we also talked about the International Overdose Awareness Day event that we're having on August 31st. It's going to be an event in the evening, so it's going to be 7 to 8:30, and we will have music. We'll have just messages of resilience, stories shared from loved ones who have lost someone close to them. We're going to have resources. If any of you work for a community organization that you feel would like to have, a table there set up, if you would personally like to share a message of resilience or share a story of your experience with overdose, it's really just allowing a space for a space of remembrance for the person who died from overdose, and allowing a space for families to kind of acknowledge their grief, and also to give hope for people still trapped in addiction. So if anyone is interested in that, you are welcome to email me and let me know. If you want to participate in any way, I will gladly accept your help. So that's it.
Thanks, Brooke. Somebody from Committee C want to give an update?
Sure. We just talked about progress on working on our community health narrative that could be a resource for any CCC member. So we've got a couple drafts going that we're adding to, and eventually we will try to compile and organize all together. We've also been working on our branding. We voted on a logo last time that we'd like to use. We made the logo on a website where we have to pay to download it. So we're working on getting like pretty much exact same similar logo, making it maybe on something like Canva for free, and seeing if we can do that or if we want to look into paying for it. So we're kind of still working on that for now, so we can kind of get branded, get our website page going, and people can know who we are. And that's all I have.
Thank y'all so much. All right. Anything else before we end? All right. I appreciate all of y'all for being here today, and we will see you next month.